I am going to introduce to you all a machine called Coolsculpting, and as the name suggests, is to sculpt the body away from the stubborn fat using a technology that freezes the fat. This is called cryo freezing, lipolysis, fat melting or breakup, and the original company that came up with it is Coolsculpting. So what does Coolsculpting do? I'm going to show you here. This is Coolsculpting. Basically, concept came from the fact that they found that children who used to love eating popsicles would actually have their cheek fat melted, and women who ride horses during winter had actually lesser fat in their inner thighs. So they found that, hey, if there's this freezing condition can actually, if it's repeatedly applied to a particular area, can actually reduce the fat. And so the concept of cryolipolysis came out. So how does it work? Basically, the applicator is applied onto the part that has fat, okay, like you see here. And when the temperature goes down to a freezing point, the fat starts to freeze and starts to die off. This is a process called crystallization, where the fat becomes crystallized, and once it becomes crystallized, it dies, and this is a process called apoptosis or cell death. So this whole process occurs immediately after the treatment and goes on for about 2 weeks to 4 weeks before everything disappears, and what's left is the part of the fat that's not destroyed. Usually about 20 to 30% is destroyed in one treatment. So then you see a reduction in the fat area. Treatment is only one time, and one time gives you a reduction of 16 to 32%. So I give an average of about 20 to 25%. Okay, this is originally it was called Zeltic, but now Zeltic is under Elegant. This machine is called a Coolsculpting machine. It's quite big, it looks like a little robot, and there's this little handpiece. This is the handpiece that comes out, and this is the part. The handpiece differs depending on which part you want to apply. If it's the tummy, this is for the tummy, then we apply like this. Okay, apply. Okay, there's a vacuum inside. The vacuum sucks in the fat. So you must make sure that there is at least pinchable fat of about 2 inches. Fat goes in, goes in all the way up to this metal piece. If it touches this metal piece, you got good draw, we call it, which means the good results as well. Okay, and if you need for other parts, we change the handpiece to suit this part. So when someone comes for a Coolsculpting treatment, what's important is to identify which area he or she needs to be treated. So once I identify the area, I will put the applicator according to the area. Because this is a very smart machine, everything is indicated here. If it's safe to go, you can go. If it's not, it will stop. Okay, so this is the difference between Coolsculpting and other cryolipolysis machine out there. There are many other cryolipolysis machine out there from other companies, but be careful because Coolsculpting has got all the safety gadgets inside. Okay, so now if a patient comes in, it can be a repeat patient or returning to the practice. I put in returning, whether it's a man or woman, I put male patient. Okay, and it's very easy. I can just indicate, it's all touch screen. I indicate which part. Is it upper tummy, lower tummy, flanks, okay, the back part, which part that I want to treat. Say in this case lower tummy, then I go on, then I set the massage or the how strong I want the fat to go in. It depends. If usually for men the skin is tight, so then the setting has to be higher. And once it started, apply onto the skin. Before that, we have to put a liner into the cup, which protects the applicator. And then there is a gel pad that we put onto the skin, which protects the skin so that you don't get frostbite. And this is very unique for Coolsculpting because it really protects the skin and the body. In my 10 years of using Coolsculpting, 8 years using this, I've not ever had a frostbite happen at all because the gel pad really protects it. In any case, if the temperature goes down so much and the freezing point is so bad, it might cause some skin damage. The machine automatically sends out a signal and stops. And this is the beauty of good technologies. Okay, so So we're gonna do a treatment for a real patient soon. Okay, so stay with us. Watch for the next video. Bye.